Fair to say everyone was shocked at the recent high-profile deaths of much-loved Australian cricket legend Shane Warne and politician Kimberley Kitching, who were both just 52 when they died suddenly from heart-related issues.
Yeah, it certainly made all of us sit up and take notice of our own health and wonder if we take particularly heart health for granted. Perhaps, if we're forewarned, more tragedies like Shane and Kimberley can be avoided.
As we get older, the GP visits and tests we need to take become more regular, Joe. A common one we're all used to is that slow-squeezing Velcro sleeve that's wrapped around your arm to take your blood pressure. It feels weird, but what is it actually doing?
There's about 5 litres of blood in the adult body, which is a lot of liquid pumping around the arteries. That's where blood pressure comes in, and the inflatable sleeve. So how does that work? The sound the doctor is listening for as the sleeve deflates is your systolic blood pressure. That's the force on the blood vessels when your heart pushes blood out. The point where the noise stops is the diastolic pressure, the pressure on the arteries between heartbeats. These two magic numbers give your overall blood pressure. And if you're pretty healthy, that should be below 120 and below 80. If either of those numbers are up, you could have high blood pressure. More than 1/3 of Aussies over the age of 18 have high blood pressure and don't know it. That's because there's often no symptoms. Left unchecked, it can lead to serious health problems, which is a very good reason to get your blood pressure checked regularly. It's painless, quick, and might save your life.
Regular blood pressure checks are easy to do, but what other tests are there to check on heart health, Joe? Well, here to tell us are not one, but we're very grateful to have two of Australia's top cardiologists. Please welcome Professor Rick Harper and Dr Brett Forge. Welcome to both of you.
Thank you.
I might start with you, Rick. The tragic deaths of Shane Warne, Australian cricketing legend, and the politician Kimberley Kitching in recent times have brought heart health to the forefront of everyone's minds, especially those in that age bracket around 50s. Are heart episodes like this generally avoidable?
Heart attacks only occur if you have plaque in your coronary artery. If you don't have plaque, you don't get a heart attack. And many people, particularly if they lead a healthy lifestyle, never develop coronary plaque. But many do, and many are unaware they have coronary plaque. And unfortunately, the first manifestation of a coronary plaque in some people can be a fatal heart attack. The good news is that there are very effective treatments to prevent that from happening. So we strongly believe that people at risk should find out whether they've got coronary plaque, and if they have, to take these preventative measures. Doing so may add many years to their life.
So, Brett, often a person has no symptoms, there's no warning, and then suddenly they have a heart attack. How common is that, and how preventable?
At least 30% of the first presentations are sudden death. And coronary death is the commonest cause of death in Australia. There's 48 people die every day in Australia from coronary disease. For comparison, for breast cancer, it's 8 or 9 women die. Prostate cancer, it's 10. So it's by far the most important and significant cause of death.
So where do you start in assessing a person's risk?
What we've done for many years has been based on the Framingham study, which looks at risk factors. I actually developed a calculator to do this about 25 years ago. You'd put in things like the age and the gender and the smoking, blood pressure, diabetes and hypertension, and then you could calculate the risk, the probability of them having a cardiac event. From that process, we use that as a basis for treating, advising lifestyle changes, and if they fail, then medication. But the trouble with that was it's just a risk assessment. It's like saying that horse is 2 to 1. It means may or may not come in. So what has been a spectacular development has been the development of these new tests, CT coronary calcium score and CT coronary angiography. So a CT coronary calcium score actually looks at calcium, measures calcium in coronary arteries, and calcium shouldn't be there. It only occurs when there's been atherosclerosis or plaque building up in the artery, which then leads to scarring and healing, and that shows up as a significant score.
Is plaque cholesterol?
Yes, yeah. So if you have excess cholesterol in your blood for long periods of time, it tends to be scavenged by certain cells in the circulation called macrophages, and it stores it away in your coronary arteries, and that causes the inflammation inside the artery, which then, if the inflammation spreads and ulcerates through the wall of the artery, you get what Rick was explaining. Suddenly you get a development of a rupture of a plaque, which may lead to a blood clot, which may block the artery.
So do you think a lot of people have assumed knowledge about their heart in as much as they think that because they're fit, they're young, relatively, that they're at no risk?
Oh, yes. Well, this actually, what got me interested in this was the middle-aged men in Lycra who, you know, they go out, they're fit and they probably never smoked and they just think they're Superman and they're, you know, racking up mountain climbs and things and they just suddenly drop dead. So they don't know. They have no symptoms and particularly men are very poor at sort of judging their risk. So there's no way you can really predict it. Obviously, things like family history are important, but they need to have a proper assessment, which is cheap and painless and can tell them whether they're at risk or not.
Rick, is it too simplistic to describe heart disease and heart attacks as a lifestyle issue? And if so, what can we do in our lifestyle to prevent getting the situation where we're at risk?
It is predominantly a lifestyle issue. And if you have a healthy lifestyle, regular exercise, and such as brisk walking, for example, you've got control of your blood pressure and you don't smoke, and importantly, if you have a sense of self-purpose and self-worthiness, all these factors are helpful in preventing plaque buildup. But the main factor is if you have a high level of the bad cholesterol, the LDL cholesterol. That's probably the most important factor and the most important factor to treat in people with plaque to prevent the plaques developing a heart attack.
Fascinated that you're talking about sense of purpose and lifestyle and community and connection as being a preventative treatment. I think that makes perfect sense to me, and I think we're understanding more about that. It's probably not a language you'd expect from your cardiologist in the past. I mean, you've been doing this for your whole life. I mean, how important are those measures?
I think they're very important. People that do have a sense of self-worth, such as politicians, for example, even if it may not be earned, have a low incidence of heart attack. But people who are out of work, feel they can't support their family, they have a much higher incidence of heart attack. The demographics of the National Heart Foundation have clearly shown that.
Can you explain the tests to us, Rick?
The test basically involves just under a CT scan to look at the calcium. It's a bit like having a chest X-ray. And if there's calcium present, as Brett said, in the coronary arteries, you must have plaque. And the score indicates how widespread the plaque is. So if you have a low score, you may have very little plaque. If you have a high score, you may have a lot of plaque. And if you have a high score, then the next step is often an exercise test to see if the heart's under strain as a result of that plaque build-up. If it's under strain, they're the sort of people that might benefit from bypass surgery or a stenting procedure. But the important thing, particularly the higher the score, the more important it is to take all these factors into account, and in particular to get your LDL cholesterol below the Heart Foundation target level of 1.8. And that's difficult to do on diet alone. You basically need a statin. And for example, all patients in Australia who've had a heart attack or have had bypass surgery or have had stents, they're all put on a statin medication, and we know that protects them from further heart attacks.
Brett, you look like you've got something you want to add to...
Well, Rick is predicting that I'm going to say this, I think, but it's worth pointing out that even those that do have stress or strain or angina, there's no evidence that stenting or surgery actually prolongs life or prevents heart attacks. It certainly improves symptoms, but you're still back to the same thing. Lifestyle factors, first, second and third, and aggressive cholesterol lowering is what works.
And do you think these tests are ordered regularly enough?
No, definitely not. And Rick mentioned, like, we still get people sent to us for stress tests because they're going to start cycling or something. Much, much better to do a CT calcium because, as Rick said, they could have really bad disease and you're not going to pick it up. You'll only pick it up if they've got a significant blockage which might be causing symptoms. So I think we'd both argue strongly that at least CT coronary calcium should be made available. It's not on Medicare, and I think that makes both doctors and patients feel it's not an accepted test. But widespread use of it should be encouraged in all but the people who are very low risk who don't need it. So probably 85% of the population at some stage, probably in men starting 45 and women maybe starting 5 years later, should be available to everyone. And it would save a huge amount of lives.
Rick and Brett, we appreciate you joining us today on the House of Wellness. Thanks a lot.
Thank you very much. Yeah.